Picture this. A 68-year-old retired postal worker still coaches Little League on Saturdays, feels fine on a Tuesday morning. He stands up from bed, and something small happens in the next 60 seconds that his cardiologist later calls the warning nobody heard. He didn't feel pain. He didn't feel dizzy. He just noticed a number. And today, we're going to talk about that number. Honestly, I know what mornings look like for a lot of people watching this. You wake up before the alarm, you lie there for a minute, listening to the house. You swing your legs over the side of the bed, you stand, and somewhere in those first 60 seconds, your body tells you something. Most people don't listen, not because they don't care, because nobody ever told them what to listen for. Maybe you feel a small wave of lightheadedness. Maybe your heart flutters, just for a second. Maybe you steady yourself on the nightstand, and then it passes. And you think, well, that's just getting older. Here's what I need you to hear first. Getting older is real, but it is not the whole explanation. Some of what you're feeling in those first 60 seconds after you stand up is your cardiovascular system talking to you. And there's a simple, at-home check, nothing fancy, no gadgets, that current guidelines suggest may reveal a pattern your regular checkup can miss. Picture someone in this situation, a composite of cases that come up often. Late 60s, retired school teacher, still tutors kids on Zoom, walks 2 miles 4 days a week. Her blood pressure at the doctor's office? Textbook, 122/78. Her doctor says everything looks good. 6 weeks later, she's in the ER with a scare that could have been caught in her own bedroom on a Tuesday. That kind of story has a name in the cardiology literature, and it's more common than most people over 60 realize. I'm Dr. Aliza Wright. On this channel, I don't treat patients. I read the research, the studies your doctor doesn't have 15 minutes to walk you through, and I translate it into plain English. Nothing on this channel replaces the doctor who knows your history. My job is to give you the questions to bring to that appointment. Before we go further, I want to ask you something. Drop 2 things in the comments: your age and the city or state you're watching from. I read every comment on this channel. It actually changes what I record next. Take 5 seconds, drop it below. I'll wait. Okay, let's get into the 60-second test, what it actually measures, and why the American Heart Association has been quietly writing about it for years. Here's the first thing to understand. Your blood pressure is not one number. It's not even 2 numbers. It's a moving conversation between your heart, your blood vessels, and gravity, all day long. And the moment that conversation gets loudest is the moment you stand up. Think of your blood like water in a garden hose that's lying flat on the driveway. When the hose is flat, water flows evenly. Now imagine you pick one end up above your head. Water has to fight gravity to reach the top. Your circulatory system does the same thing every single time you stand. In a younger body, the adjustment is instant. Blood vessels tighten. The heart speeds up a beat or two. Pressure holds steady. You never notice. After 60, that adjustment often gets a little slower, a little less coordinated. And in some people, the drop is significant enough that it has a medical name: orthostatic hypotension, which is a long phrase for a simple idea. Your blood pressure falls when you stand up. Now here's where it gets interesting. A 2011 study published in the journal Neurology, based on data from the long-running atherosclerosis risk in communities study, followed more than 12,000 middle-aged adults for about 18 years. Researchers found that people who had a significant blood pressure drop when standing up had a measurably higher risk of a cardiovascular event later in life. Not tomorrow, not next week, over years. But the signal was there, decades before the event. Read that again. The signal was there, decades before. The American Heart Association has published guidance on this. The Mayo Clinic has a full patient page on orthostatic hypotension. Johns Hopkins Medicine describes it as one of the more overlooked cardiovascular signals in adults over 65. And the reason it gets overlooked is simple. Your doctor takes your blood pressure while you're sitting, in a quiet room, after you've been resting, which is the moment your reading looks the best. The 60-second morning test flips that. It measures your pressure in the moment your body is most stressed. first thing in the morning, going from lying down to standing. But here's the problem. Almost nobody knows how to do it correctly at home. And doing it wrong gives you a number that means nothing. So let me walk you through what current guidelines actually describe. Then I'll tell you the 3 most common mistakes people make. And then, the part most people miss, I'll tell you what to actually do with the number. Step 1, the morning setup. You'll need a home blood pressure cuff, the kind that goes on your upper arm, not the wrist ones. Most cardiologists agree the upper arm cuffs are more reliable for adults over 60. If you don't own one, they run about $40 to $60 at any pharmacy. And here's a small tip. Ask your doctor at your next visit to check yours against the office cuff. They'll do it in about 2 minutes. It makes sure your home readings match reality. Do this test in the morning, before coffee, before medication, before breakfast. Sit on the edge of your bed calmly for about 5 minutes. Then lie back down. Rest quietly for 5 more minutes. Don't scroll your phone. Don't watch TV. Just breathe. Step 2. Take the first reading. While you're still lying down, put the cuff on and take your blood pressure. Write both numbers down. The top number, systolic, the bottom number, diastolic, and the pulse. Step 3. Stand up, slowly. And this is where people get it wrong. Don't jump out of bed. Don't pop up like you're late for something. Sit up first. Put your feet on the floor. Then stand calmly next to the bed. Start counting. 60 seconds. Standing still, not walking, not stretching, just standing. At the 1-minute mark, take your blood pressure again. Standing. Step 4. Do the math. This is the part that matters. Subtract your standing systolic from your lying down systolic. Then do the same for the diastolic. Current guidelines from the American Academy of Neurology and echoed by the American Heart Association describe a drop of about 20 points on the top number or about 10 points on the bottom number within 3 minutes of standing as the threshold that deserves a conversation with your doctor, not panic, a conversation. Now, number 3 is the one that surprises people because it involves timing. And number 1, the very first step, is the one almost nobody's talking about. Because if you don't rest lying down for the full 5 minutes, your baseline number is wrong. And if the baseline is wrong, the whole test is wrong. Step 5, track it for 1 week. One reading doesn't tell the story. Bodies are noisy. You want a pattern. Do the test every morning for 7 days. Write it in a small notebook or a note on your phone. Bring that page to your doctor, and here is what to actually say. Not, quote, my blood pressure is bad. Say, quote, I did a week of standing readings at home. I'd like to review these with you. Is my orthostatic response in a healthy range for my age? That single sentence changes the whole appointment. If this is useful so far and you have a parent or a spouse or a friend over 60 who lives alone, this is worth 60 seconds of their time. Send it to them, not because I need the view, because someone in their life should know how to do this test. Before the ER visit, here's the deeper piece. Why does the standing drop matter medically? Because it's a window into how flexible your autonomic nervous system still is. That's the automatic part of your nervous system, the part that runs your heart rate and your blood pressure without you thinking about it. When that system gets sluggish, it doesn't just show up as dizziness. It's associated in the research with a higher risk of falls, of certain forms of dementia, and of some cardiovascular events. A 2020 review published in the Journal of the American College of Cardiology laid this connection out in detail. That's why the 60-second morning test is not really about one number. It's about a system, and systems send early signals. One more thing before we go to the objection I know is coming. If your standing reading is higher than your lying reading, meaning your pressure jumps up when you stand instead of dropping, that's also a pattern worth showing your doctor. It has its own name in the literature, and it deserves the same calm conversation. Now, I want to answer the question I know is in your head. You're thinking, if this test is so useful, why hasn't my doctor ever mentioned it? Here's the honest answer. In a 15-minute appointment, your doctor has to review your medications, listen to your heart, check your latest labs, address whatever brought you in, and document all of it. Standing blood pressure testing takes about 8 minutes done properly. In a busy clinic, that math doesn't work. It's not that your doctor doesn't care. It's that the system doesn't give them time for the low-yield tests, even when the yield is actually higher than we thought, which is why doing it at home and bringing the results in is often the most useful thing you can do for your own cardiovascular workup. Let me name the sources one more time, because you deserve to know where this comes from. The American Heart Association publishes guidance on orthostatic blood pressure changes as part of its cardiovascular risk framework. The Mayo Clinic maintains a public patient education page on orthostatic hypotension. Johns Hopkins Medicine has written extensively on autonomic function in older adults. The 2011 neurology study I mentioned, out of the ARIC cohort, followed over 12,000 people for nearly 2 decades, and the 2020 review in the Journal of the American College of Cardiology ties standing blood pressure changes to broader cardiovascular outcomes. These aren't fringe sources. They are the mainstream of American cardiology. Now, the red flags. Because a video like this cannot replace direct evaluation. There are situations where you should call your doctor today, not next week, today. If your morning standing test shows a drop of more than 20 points on the top number and you feel dizzy, lightheaded, or nauseous when you stand, call today. If you've actually fainted, even briefly, in the last 3 months, call today. If your standing pulse jumps by more than 30 beats per minute, call today. If you've had a fall in the last 6 months you didn't fully explain, bring it up at your next visit and ask specifically about your orthostatic numbers. And if you're on blood pressure medication and your morning readings look very low, do not stop the medication on your own. Ask your doctor whether the dose or the timing needs adjusting for your specific situation. These are outside the scope of a video like this. They need direct evaluation. Let me run through the core points quickly. 1. Your blood pressure is not one number. It's a system, and the moment it's most revealing is when you stand up. 2. The 60-second morning test measures a drop that current guidelines describe as clinically meaningful. 3. Do it correctly. Lie down 5 minutes, stand for 60 seconds, take both readings, do the math. 4. Track it for a week before your appointment. 5. Bring the numbers to your doctor with one specific sentence, and let the conversation begin there. Here's the whole message in one sentence. Your body sends its clearest cardiovascular signal in the first 60 seconds of your morning, and almost no one is checking. There's one thing I still haven't told you. It's the reason this test predicts more than just heart events. It's tied to a hormone your body releases the moment your feet hit the floor. And how that hormone changes after 60 is the topic of next week's video. If you want that one, subscribe now, so it lands in your feed on Wednesday. And in the comments, I'd love to hear, did anyone else's doctor ever mention standing blood pressure? Even once? I read every response. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.